Esophageal cancer has one of the highest mortality rates. Now, traditionally, surgery to treat it has been invasive and painful. A new robotic approach is being taken at St. Joseph Healthcare Hamilton. Dr. Wael Hanna from St. Joe's and the president of St. Joseph's Foundation, Sera Felice, join us now with more. So, Dr. Hanna, you have been doing this kind of robotic surgery on esophageal cancer for a number of years, but it's not funded by OHIP. Why not?
Yeah, robotic surgery is fairly new technology, and healthcare systems like ours in Canada will rely on emerging evidence to see if this is something that the healthcare system can pay for or should pay for. St. Joe's is playing a big role in contributing to this the emerging evidence through our program, and so a lot of what we do is still not funded. The hope is that we can produce the data and the patient voice to show that this is something that they should pay for.
Because on the patients that you've operated on robotically, you say that it's much less invasive.
That is correct. So traditionally, surgery for esophageal cancer has two major incisions, one in the belly, one in the chest. It's very painful. Some patients have told us that the operation is worse than the disease. With robotic surgery, the incisions are very, very small. The recovery is much faster, and the outcomes are hopefully much better. And so that's what we are doing at St. Joe's.
Okay. And Sera, I understand that a number of patients, past patients, have actually been donors to this.
Yes, so our grateful patients and families are donors to this program, and in the robotic surgery program was actually established through donor funding and continues to rely on the generosity of the community to operate, to grow, and to evolve. We rely on donations not only to help us fund the surgical robots, but also to fund the cost of the specialized equipment required for each of those robotic surgeries that are not funded by government. And research and education are part of everything that we do at St. Joe's, and so donor funding also supports these areas so that we can continue to explore the promise of robotic surgery and introduce new robotic procedures as well.
Because it's not just that kind of cancer that you're treating with, or that is being treated at St. Joe's with robotics.
Correct.
Is it the same robot that does all of it, or are there a number of robots at the Charlton campus in Hamilton?
So we have 3 robots at the Charlton campus. 2 robots are mainly used for surgeries of the chest and the prostate. And then the 3rd robot is used for orthopedic surgery for joints, knees currently, but potentially hips in the future.
Oh, that's fascinating. And it's amazing to know that that's happening in Hamilton, that this groundbreaking research is being done, but it needs more funding.
Absolutely, and you know, we're so grateful to our community of supporters who really want to ensure that this technology and this amazing innovation continues to be available to patients in this region and right here in Hamilton. And so we are, just as the you know, as the needs of the program grow, so do our funding needs. And so we are raising money to allow us to purchase a new surgical robot so that we can continue to increase the number of robotic procedures that we can do, as well as support research and education.
And just quickly, how can people help?
Yeah, so we invite our community to visit our website at stjoesfoundation.ca/robotics, and there you'll find more information about the program, different ways in which our community can contribute to the program, whether that's through an outright gift or joining our monthly giving program or participating in some of our events. And our website also has our contact information so that you know, we invite people to reach out to us to learn a little bit more about how they can help fund the future of care.
Okay, I am fascinated by this. So we'll get the link up to our website at chch.com on how you can help. And Dr. Hanna, continued success. I'm amazed by the work that you're doing. So
well, thank you very much.
And right here in Hamilton.
Thank you.